Hi, hello, good morning. This is the live session of one of our lectures on hepatitis B infection. Your presenter is in the name of Abdul-Karim, a staff nurse at Ghana Health Service and a registered general nurse from the Institute of Quimby Nurse Midwifery Training College in the Savannah region. Now, let's start with our class. One will make mention of hepatitis B, and it will be like a strange infection, but in our daily lives, in our daily activities, we keep on hearing hepatitis B, hepatitis B, hepatitis B. What is hepatitis B? This is an infection of the liver, specifically inflammation of the liver, caused by the DNA virus hepatitis B. In the viral classification, we have the RNA and then the DNA viruses. The DNA, which is the deoxyribonucleic acid viruses, and the RNA, which is the ribonucleic acid viruses. So the hepatitis B virus is classified under the deoxyribonucleic acid viruses. That is the DNA viruses. One unique feature, let's start with some short description of this virus. This virus is a double stranded DNA virus in having a surface antigen and a core antigen. This virus has a unique and a specific feature that allows it to stay outside its host environment for almost like a week, making it one of the very dangerous virus that even after it exits its host and stays in the environment, particularly in a surface, it still has a predisposition factor of getting infected onto another person because of its nature, because it's able to stay outside its host environment for almost like a week, 7 days. Now, how do one acquire this infection? One gets this infection through body fluids or blood components of an infected person, where an already infected client or person has this virus in his blood-borne fluids components, is able to transmit this virus. And in our earlier pictures on our social media page, we displayed some entry route points of this virus into a new susceptible host. One could make mention of blood, as in health care providers, or as in accident scene, good Samaritans helping. All this is a predisposing factor. And one could also make mention of sexual intercourse, unprotected sexual intercourse, where a client or an individual with this virus in his blood component had an unprotected sex with a different client or different individual who is now having this virus. There's a predisposition that the new uninfected person involved in the unprotected sex also has this higher predisposition factor to contact and develop this virus. And also, we have usage of needles, sharing of needles, as in drug users who sometimes or most of the times share needles in their drug usage. And also, as in shaft breaking, where individuals are mistakenly or knowingly pricked by sharps has in blades, has in needles that are already infected with this hepatitis B virus. And don't forget that we made mention that earlier that this virus is able to stay outside its host environment for up to 7 days. So basically, these and others are some of the entry points or entry routes through which an individual could contact this. And one of the major entry points or entry routes is from mother to child through birth. An infected pregnant mother during labor could pass this virus to her fetus. And scientists have made mention that this, where the fetus got infected with the virus from the mother, could lead to a particular type of the infection called the chronic hepatitis B virus infection, which we'll get to there in maybe in this video or in our subsequent videos. So, what is it like to have this virus? Scientists and many researchers have come up with that an individual could have this virus unknowingly and will never detect any sign or symptoms for so long, even up to 7, 20, and even 30 years, that knowingly, dependent on your immune strength. That is why it is encouraged to do routine monitoring of your body, do routine checkups at the medical labs, at the hospitals is encouraged because of this. One can be infected without knowing because the infection has a unique feature such that you could be infected without any symptom, no sign, no symptom. And those unlucky individuals who might start to feel the symptoms or the signs of this infection will begin to have what we call the general malaise, general body weakness, and which one might not notice and relate it to other conditions or other diseases, maybe in this our setting like malaria and other, or just one can even associate it to tidiness from work. And another key sign and symptom of this uh, infection is what we call jaundice. But jaundice can also be caused by many infections or diseases, as in anemia, hemolytic anemia can cause jaundice, malaria, there's jaundice, sickle cell disease can cause jaundice. So that is another issue. And one of the pertinent sign of this disease is anorexia, where individuals will tend to have loss of appetite for food, which we can also relate to malaria because malaria easily causes anorexia. Ascites, as in abdominal distension, is it only comes at the later part of the disease where ascites, distension of the abdomen is coming, then the disease is at the later stage. So, but one key note that we have to keep in our mind is that hepatitis B virus infection is asymptomatic most at times, as researchers talk about this. Yeah. So, knowing these signs and others, how do one get to know you have hepatitis B infection? First of all, you have to get tested. We have various serological testing mechanisms which are developed over time, and the recent and the current available, affordable, easily accessible, and readily used, very reliable technique that can be used anywhere is the RDT strip. They've developed an RDT strip for testing this hepatitis B virus within body fluid, blood components, and it's very reliable. Where an individual gets tested with this RDT is able to pick up that this virus, this individual, this specimen is infected with hepatitis B virus. The only disadvantage is that it cannot quantify the viral load, and also it can't also indicate as in the extent of the disease. But it's very reliable. It's just a first point of testing where this test is being done. Then your medical doctor or your healthcare provider could then request for a more broader, more specific, more clearer diagnostic test to confirm and ascertain the extensivity of this virus infection. We also have a bit of this called the hepatitis B surface antigen test, the hepatitis B E antigen test, the viral load test. We do all this, and particularly we do the liver function test to ascertain the enzyme level of the enzyme secretion level of the liver, which would detect or show as in the extent to which the liver is being destroyed, the hepatocyte, the liver cells are being destroyed. Liver ultrasound is also one of the diagnostic tests most healthcare providers order to see the extent, imagically in imaging to review or to see the extent of the destruction caused to the liver cells. So basically, I made mention earlier on that there are categories and types of this infection. We have the acute hepatitis B virus infection and the chronic hepatitis B virus infection. Diagnosis or research shows acute, as in where a client got infected with the disease less than 6 months, chronic got the disease over 6 months. That's a basic in terms of the classification. But let's take them one after the other. The acute hepatitis B virus infection is an acute inflammation of the liver caused by hepatitis B viral infection of the liver. What are the signs to show a client is being infected in an acute stage? Most are asymptomatic, as I mentioned earlier on, but there are some individuals who also depict those signs I mentioned earlier on: the general body weakness, the jaundice, the poor appetite for food, the fatigue, the abdominal distension. It does occurs in some of the acute stages, but mostly occurs in the chronic stages. So these are what to anticipate. And mostly acute infections are caused as a result of the sharps, the pricks, and unprotected sexual intercourse and contact with infected specimen as in body fluids and bloodborne particles. What is the chronic infection of the hepatitis B? The chronic infection, as I mentioned earlier on, is infection of the liver caused by the hepatitis B virus exceeding averagely 6 months. And one specific example most researchers have given that a client or a neonate that got the infection from the infected mother during labor has a 70 to 90% predisposition to acquire chronic hepatitis B infection. But one of the good news to prevent this mother to child infection of hepatitis B virus is the use of the hepatitis B immunoglobulin. In our healthcare centers and health services, where doctors and health service providers detect that a mother is being infected with hepatitis B virus, there's an increased viral load, there's presence of this hepatitis B E antigen, then they start the planning with the mother, the pregnant mother, and the family to acquire this hepatitis B immunoglobulin on standby so that immediately after birth, this can be given to the child to prevent acquiring this infection from the mother. And after that, the hepatitis B vaccine, the childhood immunization schedule. That's why hepatitis B vaccination is on at birth. That's why if you check on your the antenatal books records, the child vaccination records, the vaccination schedules, you see hepatitis B vaccination at the birth. That's the OPV 0 and the hepatitis B. That's one of the urgent reasons why. Yes. So basically, with a chronic infection, it has a lot of predisposition factors. But one have to take note that adequate management could prevent these predisposition factors that chronic hepatitis B can lead to. Some of them being the liver cirrhosis, hepatocarcinomas, and a lot. Chronic hepatitis B infection could lead one to have liver cirrhosis, total destruction of liver cells, could lead one to have liver cancer, where the hepatocytes, the liver cells, begin to regenerate into abnormal cells. That's what the liver cancer does. The regeneration of cells too, but they won't be normal liver cells. Diagnosis and other examination will reveal carcinogenic particles within these liver cells. Getting to our last session, ending of this session of the video, how do one prevent this hepatitis B infection? How? It is approved by the World Health Organization that vaccination is the only best means of preventing hepatitis B, as a WHO approved vaccine is available, readily available, and easily accessible worldwide to prevent this hepatitis B infection. So, my encouragement, my important note to viewers is that get tested where you are negative of hepatitis B infection. Get vaccinated where you are positive of hepatitis B infection. Get in contact with accurate, approved, endorsed healthcare providers for adequate management of your hepatitis B infection. That is the only and surest way of getting rid of hepatitis B infection. One will ask as to whether hepatitis B virus infection can be cured or cannot be cured. The good news is that depending on your immune strength and depending on the time at which you acquired the hepatitis B infection, it can be cured or cannot be cured. And also depending on your adequate management strategy, hepatitis B can be cured or cannot be cured. Even those that are very fortunate and got infected, how will I put it? How will I put it? Those that are fortunate whilst having hepatitis B infection, the infection is able to get resolved by your immune function only with adequate management. And there are some that you just need a lifelong management to alleviate the symptoms of this infection. But that does not serve as a death warrant. With adequate management, you could still live to your life expectancy age. This is just a brief and a first session of our videos on hepatitis B infection. We are to serve you more on these videos and information accurately and adequately, very reliable on hepatitis B virus infection in our subsequent lessons. We do hope that the important message you got from this message, you practice it. Get tested. If you are negative, get vaccinated. If you are positive, get in touch with a very approved, reliant, efficient health service provider, be it hospital, a doctor, or an adequate health service provider that is approved to initiate management of your infection. Thank you for watching our live session, and we do hope that you do as you are encouraged. This is Abdul-Karim reporting live from Nakore in the Upper West region. Thank you, staff nurse, and a very key motivator, or how will I put it, a passionate health service provider with passionate feelings, desire to research more into hepatitis B infection and other chronic diseases. Thank you.